My name is Laura Kalina, health educator at Prince William Health Community Center. We welcome you all today to this colorectal cancer prevention workshop. March is Colorectal Cancer Awareness Month. Prince William Health Community Center, in collaboration with the community health educators and partnership members, are identifying resources for use within local communities as part of colorectal cancer screening in order to prevent and early detect rectal or colon cancer. Because our staff believes that prevention is better than cure, less expensive and less traumatic, we make of March our month of personal engagement to make colorectal cancer screening the best way to prevent colorectal cancer. Cancer that begins in the colon is called colon cancer, and cancer that begins in the rectum is called rectal cancer. Cancer that affects either of these organs may also be called colorectal cancer. Colorectal cancer, also known as CRC, is the third most common malignant disease in the United States. Almost 2/3 of CRC survivors are living 5 years following diagnosis. The prevalence of CRC survivors is likely to increase dramatically over the coming decades with further advances in early detection and treatment and the aging and growth of the United States population. The number of new colorectal cancer cases and number of deaths are both decreasing each year in adults age 55 and older. However, in adults younger than 55 years, the number of new colorectal cancer cases has slowly increased in recent years. The number of new colorectal cancers and death from colorectal cancer are higher in African American than in any other race. Some factors increase the risk of developing polyps, which may later on turn into cancer, and they are age, family history, personal history, and social history. Risk of colorectal cancer increases after age 50 and 45 in African Americans. Having a parent, brother, sister, or even a child with colorectal cancer doubles a person's risk for colorectal cancer. Consumption of alcohol, smoking, obesity, lack of exercise, and previous history of colorectal cancer or polyps can all unfortunately be great risk factors for colorectal cancer. Clinical trials are used to study ways to prevent or to lower the risk of developing colorectal cancer. Some cancer prevention trials are conducted with healthy people who have not developed cancer but who have an increased risk of cancer. Other prevention trials are conducted with people who have had cancer but are trying to lower the chance of developing new episodes. Other trials are done with healthy people who are not known to have any risk factor for colorectal cancer. And the purpose of these cancer prevention trials is to find out whether actions people take can actually prevent cancer. There are many options to check for colorectal cancer screening, like a virtual colonoscopy, which is done by a CT scanner to create a set of pictures of the colon. Another method is Cologuard, for the detection of colorectal neoplasma associated with DNA test or Colt blood and stools. But the most accurate is a colonoscopy, a procedure done by introducing a lighted tube or scope into the colon. Colonoscopies are considered the most effective method, being the preferred diagnostic tool to prevent and treat early stage of colon cancer. The main purpose of colonoscopy is to find and remove colon polyps before they can develop into cancer. The incidence of CRC has declined over the past 10 years, in large part due to the increase of colonoscopy screenings with removal of precancerous polyps. Another reason to have it done is to find cancer during early stage, making treatment simpler, avoiding surgery, and the recovery process. Most of colorectal cancer polyps are adenomas, or cells that look abnormal under a microscope, which may develop into cancer. Removing colorectal polyps may lower the risk of colorectal cancer. A colonoscopy is done by introducing a colonoscope, a flexible small tube with a video camera at the end that lets the doctor look into the colon and transmit an image of the colon to a screen. When the procedure is completed, the doctor removes the colonoscope. A removed polyp or a sample of tissue from the colon may be sent to a laboratory to make a pathological diagnosis. Before the procedure, the patient is given instructions to prepare for the colonoscopy, which includes taking laxatives to make sure the colon is empty and a 24-hour liquid diet prior to the exam. If you are over the age of 50 and still doubting whether these exams are for you, remember, CRC is the third most common malignant disease in the United States, but the good news is it can be preventable. Some factors increase the risk of developing polyps, which may turn into cancer later on, and they are age, personal or family history of CRC, and other risks such as alcohol, tobacco consumption, obesity, and lack of exercise. There are many options to check for colorectal cancer, but a colonoscopy procedure will always be the most effective because it allows a precancerous polyp to be removed and sample of tissues to be analyzed.